If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, can too much honey cause diabetes? Answer by Mike Ray. Very important question from a diabetic point of view. 100 grams of honey includes approximately 80 grams of carbohydrates, in other words, sugar. This sugar consists of 50% fructose and other 50% glucose. With that being said, if you must eat honey, you should try to get it as locally and organic done as possible. Also, eating honey is definitely better than consuming same amount of sugar, but neither is better for diabetics. The answer to your question would be, yes, consuming too much honey can most certainly cause pre-diabetes and type 2 diabetes. According to the study of the Journal of Clinical Investigation, all added sweeteners are bad for your body. There are a couple of major aspects, though, what you can do and changes in your life in order to leave sugar behind. You must switch your current diet, increase the amount of exercising, and do these 2 steps consistently for at least 21 days, preferably a 1 whole month, in order to make those new changes a permanent habit for yourself. If you are starting from the point that people usually do, overweight, poor diet, not exercising enough, you should begin with these 2 steps. By following these 2 steps for at least 21 to 30 days, you'll notice a huge bounce in your health. Furthermore, it is possible to control your sugar and, in best case, not getting diabetes in the first place. To your health. Mike Ray. Pre-diabetes diet plan. Answer by Taj Mahal honey. Of course not. Not every sweetener is a cause of diabetes. Proper knowledge will help you clear the doubt and enjoy the goodness of honey. It is proven fact that limited usage of honey is totally fine for diabetic patients. A wise method is to smartly include honey consumption in your diet. Each diabetic person responds to amount of carbohydrate differently. Being a carbohydrate source, it is to be considered that limited amount won't negatively impact the condition of the patient. Simply a single tablespoon of honey with approximately 17 grams of carbohydrate is not too much, as it can be worked out with little physical activity. Try to consume raw honey for zero risk and various other benefits. Taj Mahal honey is one such source of raw honey directly extracted from beehives and put inside bottles. Use it before you excuse it. Answer by Luis Doriocourt. It is my opinion that type 2 diabetes has an underlying metabolic foundation. People without this metabolic disorder can eat lots of high carbs, with the only downside of becoming obese without becoming diabetic. This tendency to become diabetic is possibly genetic and may be a survival mechanism for starving time. Before our modern means of food preservation, there was often a time, even in good years, when food ran short. The Plains Native Americans called the time of spring and early summer starving time because stored food was running short and there was little new food growing. Those whose metabolism is designed to store excess carbohydrates as fat will survive better on short rations. We all know people who are lean and constantly moving. They eat and never gain any excess weight. This is a personal theory. Just saying. My friend Patrick could eat nothing but honey and never get diabetes, although he would suffer from malnutrition.